Thank you, Dr. Bushra. Respected Padma Bhushan Professor Shiv Kumar Sareen, the Honorable Chief Guest and Orator for this R.L. Swarankar Oration 2022 program. Dr. Sudhir Bhandari ji, Vice Chancellor, RUHS and Principal SMS Medical College, Jaipur. Respected Dr. M.L. Swarankar, Chairperson Emeritus, who is presiding over today's program. Vice Chancellor Dr. Sachdev, Pro Vice Chancellor Dr. Saxena, Principal Mahatma Gandhi Medical College Dr. Swati Garg, eminent physicians in gastroenterology, medicine and surgery from Jaipur, eminent faculty members, staff, my dear students in the audience, and those watching the live telecast of today's program online. I, on behalf of the Board of Management of the entire family of Mahatma Gandhi University of Medical Sciences and Technology, welcome the most revered and highly regarded clinician, teacher, administrator, Padma Bhushan, Professor Shiv Sareen to our university to deliver the most prestigious oration of this institution, the R.L. Swarankar Oration. With a sigh of relief and an optimism for future, I am glad to say that after 2 years, the oration is taking place in person. As with any other natural calamity, there is always an opportunity for some radical evolution. And as human resilience is being tested, the COVID pandemic has brought a revolution in broadcasting of knowledge through the virtual platform, and this prestigious lecture is taking advantage of that and being telecast online. Sir, this is the most important oration of this university, as it is named after the founder trustee of our sponsoring body, India Education Trust, and my late grandfather, Shri Ramji Lal Swarankar. I take immense pride in stating that there could not have been someone better than Professor Shiv Sareen to deliver this oration that is so close to this institute and my family. Professor Sareen is an institution in himself. He has single-handedly set up the Mecca for Hepatology, Medicine and Surgery, the Institute of Liver and Biliary Sciences, ILBS, New Delhi, the most comprehensive center for liver and biliary diseases that is now a deemed university with Professor Sareen as its Vice Chancellor. It is very hard to find any example of one determined doctor setting up an entire institute of eminence and prestige in the government that is being run so professionally. To work and get trained there is a dream of every budding physician who wishes to be a specialist in the field of hepatology, gastroenterology. Recognizing his exemplary work, the Government of India bestowed the honor Padma Bhushan to Professor Sareen in 2007. He was awarded the Shanti Swarup Bhatnagar Prize of the Council for Scientific and Industrial Research, CSIR, the highest Indian award in science category in 1996. He has helped in evolving more than 17 different treatment protocols for a variety of liver diseases and their management, such as band ligation for variceal hemorrhage. Professor Sareen's research has helped our fraternity understand two major liver conditions in depth: acute and chronic liver failure and portal biliopathy. His work has assisted in understanding of chronic HBV infection, liver cancers, and the variants of hepatitis B and C. A detailed introduction and citation about Sir shall follow in the forthcoming section of this program. आप मेरे पिता तुल्य हैं और यह हमारा परम सौभाग्य है कि आपके चरण कमल पुनः हमारे इस विश्वविद्यालय के प्रांगण में पड़े। श्री रामजी लाल स्वर्णकार द्वारा प्रदत्त संस्कार हमारे संस्थान की वैचारिक नींव हैं, आइडियोलॉजिकल एंड कंसेप्चुअल फाउंडेशन, एवं उनके द्वारा प्रेषित किए हुए सिद्धांत हमारे मार्गदर्शक हैं। मेरे पिताजी मेरे दादाजी द्वारा दी गई सीख का स्मरण अक्सर मुझे कराते हैं। परहित सरिस धर्म नहीं भाई, पर पीड़ा सम नहीं अधिमाई, परहित बस जिनके मन माही, तिनके जग दुर्लभ कछु नाही। The well-being and welfare of the humankind should be the fundamental guiding principle of all our deeds and actions. This is also the ultimate obeisance to the Almighty God. I have a firm belief that the traits of determination, perseverance, and integrity of character have been inherited in my father from my grandfather. Not only morally, he was physically very fit as well. He could walk for a couple of kilometers upside down on his hands during his young days, and even at the age of 84, barely 30 days from his demise, he could do 30 push-ups. Eat to live and not live to eat. What was his secret to this fitness? As he ate very limited food for the major part of his life. His entire day's food was a bowl of dalia in the morning, dal with a couple of rotis in the evening, and a glass of milk at the night. This was his only meal for the entire day. Probably he knew that this would keep his liver fat-free and healthy. The services provided by Mahatma Gandhi Hospital during the COVID-19 pandemic is the tribute to our founder trustee, Shri Ramji Swarnakar, in true sense and spirit. I can state with pride that our team of doctors, residents, nurses, and paramedical and administrative staff worked tirelessly during the COVID-19 pandemic and are still prepared for any eventuality. I owe my sincere gratitude to them. Our hospital is the largest private state government designated tertiary COVID care center. Plan for the worst, hope for the best has been our philosophy. The institute deployed large-scale infrastructure with over 1,000 beds with piped oxygen supply, 400 ICU beds with close to 150 ventilators, 5 ECMO units, oxygen concentrator, and the state's largest oxygen generation plant as a backup for our liquid medical oxygen reserves. There was a forecast for overwhelming number of pediatric patients during the third wave. Thankfully, the third wave turned out to be mild, but the institute started a 25-bedded pediatric ICU unit along with a dialysis and renal transplant unit catering exclusively to kids. State's first RT-PCR lab for COVID at our center has performed over 3 lakh COVID RT-PCR tests so far. Sir, most humbly I put forth that we now have an established live related donor liver transplant program. We are performing close to 2 to 3 transplants a month with good results and have performed more than 25 liver transplants so far. The credit for this goes to our digestive sciences team encompassing HPV surgery, hepatology, GI surgery, and medical gastroenterology led by Professor V.K. Kapoor, former professor and head GI surgery at SGPGI, Dr. Vivek Saraswat, former professor and head gastroenterology, SGPGI, Dr. Nemish Mehta, visiting honorary faculty from Sir Gangaram Hospital, New Delhi, Dr. Ajay Sharma, a highly skilled and dynamic laparoscopic GI surgeon, Dr. Shashwat Sareen, energetic and very skilled liver transplant and HPV surgeon trained in Turkey and in ILBS, Dr. Karan Kumar, a very bright and competent hepatologist from ILBS, Dr. Anand Nagar, and Dr. Vinay Mehla. Mahatma Gandhi Hospital, the NABL accredited teaching hospital of the university, is doing pioneering work in the field of renal transplant, not only in the state but nationally. The comprehensive oncology services in medical, surgical, and radiation oncology, along with oncoplastic surgery, nuclear medicine, and oncohistopathology, have been doing some phenomenal work in the field of oncology. Bone marrow transplant for neoplastic and thalassaemic disorders is being routinely done at the Sri Ram Cancer and Super Speciality Center. Advanced and complex surgeries are being routinely performed by the Center for Neurosciences and the Cardiothoracic Surgery Department. Also, the university is planning a separate dedicated building for the Institute of Digestive Diseases, encompassing all the 4 branches, medical and surgical gastroenterology, HPV surgery, and hepatology under one roof, and is scheduled to be commissioned in the coming 2 years. The university envisions to develop into an institution of excellence at par with global standards in the field of healthcare and allied sciences that is driven by top quality teaching, training, clinical practices, research and innovation. Mahatma Gandhi Medical College and Hospital is an NMC recognized Government of India approved medical college having 250 annual undergraduate admissions, more than 150 annual postgraduate admissions in all medical specialties, including nuclear medicine, emergency medicine, family medicine, palliative medicine, etc., and an annual intake of more than 50 students in super specialty DMMCH programs in medical surgical oncology, medical surgical gastroenterology, HPB surgery, neurosurgery, urology, cardiothoracic surgery, neurology, nephrology, reproductive medicine, neuroanesthesia, organ transplant anesthesia, etc., to name a few. The first and only exclusive medical university of the state, the Mahatma Gandhi University of Medical Sciences and Technology, also has a DCI recognized postgraduate dental college, postgraduate nursing college, postgraduate physiotherapy and occupational therapy college, and offers various other courses in health informatics, hospital administration, and other allied fields of medicine. With the blessings of Almighty God and elders, and due to untiring efforts of our faculty and staff, Mahatma Gandhi Hospital enjoys the reputation of being a high-quality, transparent, non-exploitative tertiary care hospital amongst the patient population and society at large. Sir, presently we are the biggest service provider in the private sector for the flagship health scheme of the state government, Mukhyamantri Chiranjeevi Swasthya Bima Yojana, and the Rajasthan Government Employees Health Scheme, the RGHS. With this brief introduction about the institution, I, on behalf of my mother and Vice President, India Education Trust, Srimati Meena Swarankar, my uncle, Sri R.R. Soni, the Chief Finance and Accounts Officer of the University, my brother, Dr. Shobhit Swarankar, and the entire MGUMST family, once again formally welcome Dr. Professor Shiv Sareen, and formally welcome all of you to this oration program. And we all are eagerly waiting to listen to the wisdom of Professor Shiv Sareen. May God bless us all. Jai Hind.